Original Medicare by itself was enough to cover most of the healthcare costs that seniors had, that is prior to the age of super expensive medications and healthcare procedures. But in modern times, like today, many beneficiaries find it really necessary to have something more to make sure that all their bases are covered, but also not to sacrifice the wide swath of choices of doctors and networks and hospitals that are available through Original Medicare. That is when in steps something like a MediGap, also known as a Medicare supplement plan. So let's talk about that. This is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, extra help, prescription drug coverage, MediGap, and really the whole kit and caboodle that is Medicare. But before we get to it, please don't forget to like and subscribe, because it'll help you stay up to date about the newest Medicare changes, the newest Medicare options, and also give you ways to make better, more informed Medicare decisions. All right, here we go. So in the last video, we went much more into depth about Original Medicare. So if you want to check that out, I'll put a link up here, check that out, and you can get kind of caught up on the Medicare side about what Medicare is. But in short, right now, Original Medicare is the first two parts of Medicare that were there since the beginning, hence Original Medicare. Specifically, that is Medicare Part A and Medicare Part B. Under Medicare Part A, folks have coverage for hospitalization, while under Medicare Part B, beneficiaries will get coverage for normal day-to-day costs, like doctor's visits, lab work, x-rays, specialist visits, etc. As far as how much is covered under Medicare Part A, there is a deductible and a daily rate for hospitalizations that charge a cost per each day a person is in the hospital, up to an ultimate number of days, at which point the beneficiary becomes responsible for 100% of hospital costs. For Medicare Part B portion, there is a deductible, and then there is co-insurance, which breaks down to roughly a percentage between Medicare and the beneficiary that is 80% paid by Medicare and 20% paid by the Medicare beneficiary. In both cases, no matter what the coverage structure is, there is not an ultimate limit to the total amount of costs that somebody could have when they have healthcare usage. And it can be a lot. Even at the 80-20%, if you figure 20% of $100,000, that's still $20,000. So there are definitely spots in the coverage of Medicare that could leave a beneficiary with big bills. But the biggest benefit to Original Medicare is that there is no hospital networks, doctors networks, or management of the care that somebody gets. So if a doctor accepts Medicare, a beneficiary can go see them if they are in their own backyard or if they are halfway around the country. As long as that doctor takes Medicare and of course is accepting new patients, then the beneficiary can see them. Now, this is the point where a MediGap plan or Medicare supplement plan steps in and is most advantageous for a beneficiary who decides to get one. MediGap plans are provided by private health insurance companies, many whom you would know, and also a couple that you probably wouldn't. And the functionality is pretty simple because, like the name implies, in MediGap or Medicare supplement, they cover things that are not covered by Medicare. They cover those gaps, or they supplement Medicare. For example, Medicare Part B covers 80% of doctors' costs, and the MediGap plan can pay for some or almost all of the remaining 20% not paid by Medicare when someone goes sees the doctor. The MediGap plans essentially piggyback on Medicare and supplement the coverage that somebody has through Medicare. Additionally, since they are just covering the costs not covered by Medicare, there's not a management of care. There's not an HMO or a PPO. And as the beneficiary is still able to go see a doctor in a hospital, really any of those doctors or hospitals who accept Medicare, which, you know, there's a lot. There are many, many, many doctors and hospitals who take Medicare. Now, this is a pretty big contrast to a Medicare Advantage plans like the ones we talked about previously, where someone's doctor's options and procedures are going to be managed by an HMO plan. And they can limit the doctors that a person can see to really only those doctors that are within the contracted network. So Medicare supplement plans seem ideal, right? They seem pretty good in the sense that they can cover up to almost all the costs not paid by Medicare, and they don't limit the doctor or the hospital options of the Medicare beneficiary. So yes, they are definitely good, but the catch is that there is a monthly premium. And even though most of the healthcare costs will be paid for that 20% that's not covered by Medicare if services are used, one thing that is always going to be paid by the beneficiary is going to be that monthly premium, whether they go to the doctor or utilize services or not. Now, these Medicare supplement monthly premiums are going to be on top of the standard Medicare Part B premium that folks are paying, and often it comes out of their Social Security check, which is in 2024 $174.70. So the beneficiary pays to keep the Medicare Part B, and depending on the extent of the MediGap plan or the Medicare supplement plan that they choose, he's going to have an additional cost that can be equal to or even greater than what they're paying for the Medicare Part B. Added together, MediGap plans can put a lot of stress on seniors' healthcare budgets and may even put them into situations where it's unaffordable. And that is also not including the additional cost that comes for a Medicare Part D plan to cover the medications that are never covered by OG Medicare or Original Medicare or the Medicare supplement plans. So if we're going to compare the difference between Original Medicare and Medicare supplement, it's more of a symbiotic relationship because first, it's not possible to get a MediGap or Medicare supplement plan unless someone has both Medicare Part A and Part B, Original Medicare. Additionally, Medicare supplement plans or MediGap plans, they only cover what is not covered by Medicare Part A and Part B. So it's not really full insurance, it's just additional coverage to pay what is left over from Medicare. So if someone does want to have Original Medicare without having a supplement, then they would be left with the higher risk of paying medical bills because of the limitation of the coverage that Medicare offers, primarily the deductible and the daily cost for Medicare Part A, and the 20% responsibility that they would have under Medicare Part B without a limit. But if someone does get the most comprehensive coverage through a Medicare supplement plan, then those costs will drop dramatically when they go utilize the doctors and the services, but the monthly costs will go up for sure. One last thing to mention about Medicare supplement plans or MediGap plans is that they do not cover the cost for prescription medications, and neither does Original Medicare. That means that in order to have coverage for prescriptions, it would be necessary to get an additional Medicare Part D or a prescription drug plan, which will have additional costs added on top of the monthly MediGap plan and on top of the Medicare Part A and Part B premiums as well. But if someone does have that trifecta of Original Medicare, a MediGap plan, and a Medicare Part D, they're going to have very good coverage, but the monthly cost is going to be very good too. So overall, when we think about the difference between Medicare and MediGap, they are really more better to think about as working together. Is MediGap better than Medicare? Well, no, because you can't have MediGap without Medicare. Is MediGap or a Medicare supplement better than a Medicare Advantage? That is a much bigger question that we will get into in future videos. But for most beneficiaries, they do face this choice between Medicare supplement or Medicare Advantages when they're looking at what are the Medicare options. So those things will depend pretty heavily on a person's personal health situation, how much risk tolerance they have, and which doctors and hospitals they would like to have access to. Now, the strongest advantage to a MediGap plan is that it can potentially cover most of the costs not covered by Medicare and not limit somebody's doctors that they can see. But the cost to it is that limiting factor, the monthly cost. And for our clients who are mostly focused on costs, MediGap prices become a really big factor in their decisions. All right, so that's going to be it for today for Michael's Medicare. And if you have additional questions or you want to get more information about your specific situation, feel free to reach out to us at the information down below, or leave a comment, or give us a call, or check out our other great videos on the socials on YouTube and Instagram. We got new content coming out every single week. So for Michael's Medicare, I'm Michael, hoping that you have a great rest of your day, and goodbye.